CARICOM and Ireland strengthen relations as the first ambassador of the European country accredited to the community. Lahars pose new threat to ash-covered St. Vincent and the Grenadines. And schools reopen in Barbados after delay from La Soufriere ash impact. Welcome to this week's episode of the CARICOM News Time. I'm Tusankin English Francis. Thank you for joining us. CARICOM and the Republic of Ireland formalized relations on April 20th with the accreditation of the first ambassador to CARICOM from the European country. His Excellency Sean Hoy presented his credentials to the CARICOM Secretary General, Ambassador Erwin LaRocque, in a virtual ceremony on Wednesday, April 28th. The Secretary General welcomed his appointment as an affirmation of Ireland's growing interest in strengthening relations with the community.
It is a meaningful step towards greater understanding and cooperation between our countries and follows a series of high-level interactions over the last few years. I recall in particular the delegation led by your former Prime Minister, Enda Kenny, which was present at the opening of the 31st Intersessional Meeting of the Conference of Heads of Government in Barbados last year. Also, the Honourable Simon Coveney, the Deputy Prime Minister and Minister of Foreign Affairs of Ireland, met with our foreign ministers on two occasions. Among the issues discussed was the blacklisting by the European Union of some CARICOM member states who have been labelled as non-cooperative tax jurisdictions. In particular, your support is needed on this issue. Being blacklisted is causing severe reputational damage to those member states and results, among other things, in adversely affecting correspondent banking relationships. As a member of the EU, we urge that you advocate on our behalf to end this unjust and unfair listing of those states who have been certified by the relevant global authorities in keeping with their standards.
Ambassador Hoy said his appointment signifies Ireland's commitment to building closer and deeper relations with the community and its member states. He said that Ireland looks forward to continued close collaboration with CARICOM in the context of its relations with the European Union.
We are well aware that the EU can be a complex place in which to operate. Ireland sees itself as a country that is a good listener and one that is happy to provide insights and connect you with relevant contacts across a range of policy areas. We will continue to seek to bring your concerns to the attention of our EU partners.
La Soufriere volcano is quiet, but secondary hazards such as lahars or mud flows caused by heavy rains have caused authorities in St. Vincent and the Grenadines to issue warnings for persons to stay out of the red and orange zones of the volcano. Lahars, dense mixtures of ash and water, create mud flows that destroy everything in their path as they rush down the volcano slopes faster than a river. The Agency for Public Information said the Royal St. Vincent and the Grenadines Police Force will be restricting persons traveling into the red zones as well as the orange hazard areas. As Latin American and Caribbean countries continue to experience difficulties getting adequate supplies of vaccines against the COVID-19 virus, Director of the Pan-American Health Organization, Dr. Carissa Etienne, has called on countries with extra doses of the coronavirus vaccines to share with the Americas. In her April 28th media briefing, Dr. Etienne said that the region has demonstrated it can distribute vaccines quickly and effectively, yet supplies lag behind the number of doses urgently needed.
And that's why we want again to urge countries with extra doses to consider donating a significant portion of these to the Americas, where these life-saving doses are desperately needed and will be promptly used. Vaccines are especially important for vulnerable populations, like our migrants and the millions living along our borders, where we have seen outbreaks surge and ripple across our region. Expanded vaccination will also ensure that our people and economies can begin to reopen, rebuild, and recover.
In the last week of April, PAHO data showed 1.4 million new coronavirus cases, and more than 35 deaths in the Americas. Some countries in the CARICOM region have recorded alarming rates of infection. Even countries that did well in managing the pandemic early on, such as Anguilla, instituted a COVID-19 precaution pause on April 22nd for 2 weeks. In Trinidad and Tobago, Prime Minister Dr. Keith Rowley announced new restrictions from April 30th. Up until May 30th, gyms, malls, beauty salons, churches, and cinemas will be closed. Only essential travel will be permitted in and out of the country.
We are forced now to restrict the opening hours again from 6 a.m. to 8 p.m. for food supply stores and pharmacies. And these are the essentials, and we are saying to the population again, for the days ahead as described, if you don't have to come out as an essential worker or don't have to come out for essential business, stay at home, stay away from people.
Trinidad and Tobago's Health Minister, Terence Dial Singh, warned that if the high case levels continue, hospitals simply would not have enough space.
I just want to re-emphasize to the public that we only have about 10 days of hospital space left for you in the parallel healthcare system. It means if as a society we don't adjust to the measures that need to be done, when granny, uncle, daddy, mommy needs a bed, they may not get one. And we will not be housing anyone in the traditional hospital system. I just want to reiterate that whilst we can add beds, there aren't hundreds of nurses and doctors out there to just bring on. Let me re-emphasize that. Our medical personnel are under tremendous pressure. And we can't run a hospital at 100% flat out for any length of period.
Meanwhile, Minister of Health and Wellness of Jamaica, the Honorable Christopher Tufton, has urged Jamaicans to continue adhering to COVID-19 protocols to avoid a third wave of the virus.
It is quite clear that the first surge was not as severe as the second. And the second surge brought with it far more challenges. And we raise that point to say to the populace, we recognize the progress we're making as a consequence of the sacrifices that have been made from the restrictions, the better enforcement by self-enforcement as well as by the law enforcement agencies, the Jamaica Constabulary, the restrictions that have had an impact. And I want to commend both the health team, the other agencies, and the populace in respecting, for the most part, those restrictions. And we have seen the benefits of that with this week, a positivity rate for the first time this year being just over 10% and an average 7-day rate of just over 15%. Remember now, we had a 40% in the peak of the second surge. But the substantive point is the second was worse for us as a people than the first. And we therefore have to be careful and not be complacent so we do not have a third wave, which would likely be worse than the second.
Primary school students in classes 3 and 4 and secondary school students in 5th and 6th forms resumed schools in Barbados on the 3rd of May. The reopening, initially scheduled for April 26th, was delayed by 1 week to facilitate cleanup of ash from La Soufriere volcano.
We've been cleaning up a lot of the ash at the various institutions, and I think just as we are having challenges within our own households, the schools are also having challenges trying to clean, and then obviously there's a gust of wind and we end up in a situation where we have another set of cleaning that has to be done. So I anticipate that over the course of the next couple of weeks, as we return to school on Monday, that we will obviously have to continue cleaning a number of the schools on a regular basis in support of the ancillary staff. But we've been able to put in place a maintenance program whereby in particular the schools that are particularly challenging, that we're going to have the additional assistance from the contractors coming back in to help support a number of the ancillary staff at the various schools.
Acting Chief Education Officer Joy Adamson said those students who have not returned to the physical classroom will do so remotely.
Generally, we're saying that the duration for school is 5 hours. So that means that teaching time will stop at 2, and therefore parents will make arrangements for the collection of the students then at that end. School monitors will also be monitoring throughout the day, assisting with the sanitization and also assisting with the arrival and the departure of the students from the school. The ministry is also coordinating when the other classes will have the opportunity to be face-to-face as well. So if we will be making that announcement, so if we know for sure on Monday is class 3 and 4, and then we'll be making a further announcement when another group of children will be able to come in face-to-face. In the interim, they are to have all their classes online, and that will continue, but we will continue to give updates on a regular basis.
Dr. Warren Smith bid farewell to the Caribbean Development Bank on April 30th, retiring from his position as president. In his farewell engagement with the board of directors, Dr. Smith reflected on the successes of his 10-year-long tenure, noting that larger financial institutions are now channeling increased levels of resources through the CDB, giving donors and beneficiaries better value for money. Under President Smith's leadership, membership in the bank increased to 28 members, with Suriname joining in 2013 and Brazil in 2015. The bank established its first country office in Haiti in 2018. Dr. Hyginus Gene Leon took over from Dr. Warren Smith as president of the CDB from the 1st of May. For more stories, you can visit the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org. Like our Facebook page, follow us on Twitter, and be sure to subscribe to our YouTube channel. Thank you for watching. Be safe and see you next time.